Everyone.
Hello,
Welcome to our
hello.
Prairie Circle Chat this Friday after a super long week. I don't know if you guys are feeling that, but
Yes.
I'm ready, ready for tonight. So thank you all for joining us so much. We really appreciate it. Here at Prairie, we're all about education and really helping and supporting our community of people and support and all these incredible humans that we have in our circle and sharing their stories and their information with you. So today we have Toni and Natasha, and I'm going to let them introduce themselves. I won't let them, they will, with all of their fancy titles and a little bit about who you are and what you do. And today on our circle chat, we're really talking about post-surgical recovery and tips and some information specific to oncological recovery. So with that, I'll quick introduction. My name is Holli Markwald. I'm the CEO here at Prairie Wear. And Natasha, would
All
you like to introduce
right.
yourself?
Good evening, or at least good afternoon, good evening, wherever you are. My name is Natasha Ewa, and I am a breast cancer survivor, psychotherapist, um, business owner, author, photographer, and very picky eater who drinks too much coffee. Too much coffee, but I have water today.
Nice. And amazing model,
Oh,
we must say.
thank you.
Mm-hmm. Mm-hmm. Yeah. Toni.
And I'm Toni Storm. I'm a surgical oncologist. I specialize in breast cancer care, and I'm a mom as well, and I'm happy to be here.
Cool.
Yay.
Thank you. These are two really special humans, you guys. I will say that I am better for having met both of you. And for those of you that might not know a little bit about Prairie, Toni was integral in teaching us about how to really create something that worked for a body in recovery and how do we support a body in recovery. And she and her amazing surgical team, which I know are going to tune into this and watch and give you their feedback, Toni, were really integral in us learning about how we can do our best job for the body and compression and coverage. So that's Toni's very special. Yeah. And I think I can't remember how many times you've been on with us, Natasha, but I'm always like, can we invite Natasha? How about Natasha? Because
Oh, that
I
warms
just
my heart.
I just love how much you genuinely and authentically want to educate and support the community. I love it. Like, I just love it. It shines out of you in your posts and when you join us. Yeah, I just really love it. So, no pressure, you guys, to perform. I just wanted to share with our Prairie Circle chat that we have such special humans with us today and really appreciate you guys joining us. So, we have some kind of general questions and we can talk about anything that you guys would like to talk about as well. But there's often some kind of three things or a few things that people should or shouldn't do post-surgically, specifically with a mastectomy or an oncological surgery, which can cause more trauma to the body after surgery. Would you like to take the first go at that, Storm,
Sure,
Dr. Toni?
sure.
Huh.
So if someone has had a mastectomy with or without reconstruction, what we wouldn't want them to do is obviously go into an unclean environment, meaning, and I've actually had patients do this, do not go water skiing with your drains in.
Right.
Not
Oh,
ideal, because remember, the things that live in the water go potty in the water, so we don't want to do that. And then I would say anything really extreme. So even if you're feeling really good, you would not want to do any movement that was really extreme or really repetitive in that early surgical time. You want to let those skin flaps, everything heal and kind of settle down, and you want to be able to get rid of your drains as quickly as possible. So you want that fluid that's being generated to not be in any way geared up to make more. So you want
Mm.
the muscle and the skin to scar down if it's a mastectomy, again, with or without reconstruction, so that you don't get a fluid pocket. And if you're too active, and that doesn't mean bed rest, it means it's no spring cleaning, none of that stuff. Just kind of take it easy. That is the way to kind of maximize things. So because women tend to be overdoers, it's like, I have 5 minutes, I have to clean something.
Yeah.
So I would say, imagine you're taking care of someone else. What would you tell them? Because that's what you should tell yourself.
Mm, that one sat with me, that I have 5 minutes, let me clean something. Definitely did. So I learned very quickly what you just said, Dr. Storm. I apologize. One moment. That's my son. Right there.
Making an appearance. I think that is, in terms of movement is great, but also so is rest and really listening to your body and taking that moment. And we're not good listeners necessarily in terms of being busybodies quite often. So I think that's a really good reminder. And when Natasha comes back, we'll cover off her experience as well. But I think another thing that you just mentioned in terms of scarring down and making sure that that movement is not increasing seroma or fluid, why is compression helpful during recovery?
So I really want to answer this because this is where I think the garment really stands out. But I want to take 1 second to say how incredibly wonderful it is that Natasha just went off the screen for 2 seconds to see her son. And she is a breast cancer survivor and a mom with this beautiful, wonderful little boy that we were hearing about, because you can absolutely beat this disease and not be defined by it and go on to be all those things that you want to be. And even for the women who have more advanced disease and maybe they can't have the cure, they can still have their life to the best degree we can help them with that, so that again, they're not defined by this disease, because we're so much more. And how wonderful to see this, even though we didn't see him, hear this beautiful, wonderful little life.
Thank you so
Yeah.
much for saying that. I just hopped back in, and I feel like I hopped back in at the right moment, because honestly, Dr. Storm, I know when I was first diagnosed, that was the very thing that I was fearful I would not have. And I think a huge part of it is, at least for me up until recently, when you hear the word cancer, it's typically associated with doom, right? And that it's kind of the end of a lot of things as you know it. And I just could not wrap my brain around, the things that you just said or were still possible. And I believe that that's a narrative that needs to be fostered a lot more. Things are different. Yes, things do change, absolutely. But normalcy, patterns, positive things that you would have wanted before are still possible. Because I just don't know that a lot of time is spent on the other side of fear when it comes to, just breast cancer, or really any type of cancer.
Absolutely. Cancer is so scary, and knowledge is our friend. And being able to be your own advocate, and Natasha can speak to this as well, but being able to say, I want to understand what's happening. You can feel free to say, why do you want me to wear this garment? Why do I need to have radiation? What does radiation do? Is there cancer left? Am I cancer free? When am I cancer free? What is my recurrence risk? I want people to feel empowered to have those questions answered, because it is scary. And when we bring things into the light, they're less scary. It doesn't make it easy, does not make it easy,
Yeah.
but it does help make it less scary, and it allows women to be part of their care, and men. And that is huge. So to transition to Holly's question,
Well,
the
I
the
actually, before we jump
oh,
into that, now that
yes.
Natasha's back, you brought up one of the things that I wanted to bring up with Natasha, which is you did a beautiful post about, and Toni, I'm sure you didn't know this, about having being a breast cancer survivor and having a child and sharing that experience. And I was reading a lot of the community in their comments, and it was just like, I thank you so much for sharing this. I really had a worry that I wouldn't be able to have a child. I didn't know what it was going to be like. I didn't know if it was possible, all those things. And I actually just got goosebumps because that is one of the really wonderful gifts out of many that you give people, which is just normalcy to something that feels sometimes, you know, incapable of understanding, if that makes sense.
Absolutely. I mean, it feels daunting. And I think that there's another part too. There's for many, obviously not everyone, the desire to start a family, go on and have children. But then the other part of it is being there for the children that we bring into the world. And that's also
Huge.
sometimes scarier than whether or not I can have kids after, a cancer diagnosis. And I know that that's something that I've battled with, and I've heard many other survivors and thrivers talk about, I want to have kids, or I now have a child, but what if I'm not here 10 years from now? What if I'm not here 4 years from now? And being able to find joy in the now so that you can fulfill it regardless of what 10 years from now looks like. And again, like you were saying, Dr. Storm, far from easy, but doable with skills, support, and other things. It's a journey, right? It's a journey.
It really is. I love, though, that, I mean, having your son, it shows that life wants to exist, that life goes on, and that this is not about a breast cancer diagnosis being about pain or being even about death, but a breast cancer journey being about choosing life, however that looks. And it looks different for a lot of different
Everybody.
people. I have patients who have been diagnosed while pregnant and have been able to receive their chemo while pregnant and give birth to a completely healthy baby. So there are many options, and I really want to empower people to be able to know I have choices, I have options. I can feel free to ask about those. I can ask for a specialist who's more comfortable perhaps managing a younger patient. What are my risks of a recurrence? Should I have a mastectomy or a lumpectomy? And really being able to be part of all of that and that decision making. And one of the things too that's really hard with cancer and any cancer diagnosis is the fear of recurrence. But
Yeah.
I don't feel like it's real, and it's very real. And PTSD, or post-traumatic stress, from this diagnosis and treatment is real, and people absolutely have it. But I want to remind all of us, including myself, that life is tricky. It can be extremely hard. It can be brutal. It can be cruel. It can be beautiful and wonderful and fun and lovely, all in the same day, half the time at the same time. So this is life. It is such a mixed bag. So we can't live worrying about what could happen. We need to take what we have and we need to live in it every day the best we can. Easily said, hard done, but something I really want to encourage everybody with. And I'm a cancer survivor myself. I did not have breast cancer. I had a different kind of cancer, but I know how that feels, and I know that fear. So I'm there with you guys, and I'm also really with you in the idea that we're going to live and love life the best we can.
Mm-hmm.
I love that. I love that. Dr. Storm, as you were talking as well, thought that came to my mind. I was just kind of thinking back to when I was going through recovery for my mastectomy. As you are resting as you're supposed to, right? No spring cleaning and all of those extra things. It feels like you have idle time. And as we know, during idle time, what happens? We overthink. And so one of the things that I found is keeping my mind busy creatively, because I couldn't keep my body busy during the healing process. Otherwise, I would spend too much time considering the what ifs. And so, again, just as you were speaking, it brings me to say that one of the ideas that I try to share when it comes to recovery after, surgery and mastectomy is keep your mind busy creatively, because you can't necessarily keep your body busy, just to help yourself to continue moving forward and not getting stuck in that place
I
mentally.
think that is brilliant. I think that is also a brilliant point in terms of when we want to do something for those people we care about who have had this diagnosis. One of the best things we can do is give them something to do like that.
Mm-hmm.
Maybe it's, they now have these incredible little 3D puzzles where you build little worlds. I don't know if you guys have seen any of those, but you can build like library. They're so cool. Anyhow, the gift of engagement. Engagement that's not, I don't have to be ready. I don't have to necessarily have somebody over for hours because you're tired. You really want your guests to come and go pretty quickly, not to stay for a long time, but leave you something that entertains you. And we know what our loved ones like, and picking something like that, because Natasha, that's brilliant.
Yeah.
I'm stealing it.
I haven't patented it yet, so you're good.
She's got lots of gems. I feel like the two of you should exchange numbers, because
I
a
agree.
lot of what you said are actually things that I've read on Natasha's posts over the last several years, is the empowerment of education. It's scary. It doesn't make things easier, but it makes things clearer, and it gives an opportunity to make an educated choice and decision. And you guys both are very similar in that, get educated, understand, be a self-advocate, ask the questions. And I think that goes for anyone and everyone. And I think even more so when you feel in your heart, like, I just don't understand, or I don't have, I can't, I don't feel comfortable with this information, ask.
Mm-hmm.
It's important that you do feel comfortable, that you do understand, that you have the information that you need to make a choice. So I love that you guys are very similar, coming from different sides of it, but it's interesting what you're saying on education and caring for yourself. So I think I was looking for a segue, and Natasha, you would do this so much better than me, but my brain is not working on this Friday. I'm sorry, guys. So one of the things that we were talking about as you stepped away was just that movement
Mm-hmm.
post-surgically, and how important it is to move, but also how important it is to keep compression in those areas, because you
For
do
sure.
want that, the skin and the scarring to, what did you call it, Toni?
You want it to attach, you want it to
Mm-hmm.
heal together, to scar down. So you don't want a potential space. So you don't want this kind of horizontal movement. You want those tissues to heal together. And that way you're not going to get that fluid collection. It's going to improve the cosmetics. So those things are very important. If you're having reconstruction, if it's implant based, you're going to have probably your implant over the muscle, since that's the way we do it quite frequently anymore. Or maybe you're having autologous or reconstruction that uses your own tissues. You still don't want that fluid, and you want that blood supply to be able to reestablish itself. So being able to have enough movement that you're getting around, you're not just sitting, but you're not overdoing it, that sweet spot. And I think that using a garment like the Hugger really helps to do that, because one, it doesn't have a bunch of seams, so it's not cutting off the blood flow, but it's also compressing in a very even way all around and sculpting around the breast. And I think too, because we do have the side panels go up quite close to the axilla or to the armpit, that it's a little bit of a reminder, hey, this, you just had surgery.
Yeah, that makes sense.
Mm-hmm.
That makes sense. This might be, I don't know if this is going to sound far-fetched or not, but well, first I'm wearing
Oh,
mine right now.
Yeah.
Um,
lovely.
I was like, one day I was just sitting there and I was like, how cool would it be for hospitals to hand out hugger bras instead of, and I think back to the one that I was given, because I went into surgery on the 22nd of February 2017, and exactly a week later I had to go back in because I had an infection. So they had to wash me out altogether. And I actually still have all of the bras that they've given me, but I've never reworn them because they did not, for the most part, except for one, none of them had any compression whatsoever. They were just very thin, non-wired bras, but they did not come up close to the axillary of the armpit area. They just kind of clasped in the front, and that was it, but no compression at all. And I was like, so how cool would it be if, hospitals found a way to hand these out, provide these to the patients versus those bras? Like some sort of
I
mass collaboration.
I so agree. We at the hospitals that I operate at, they do. So we put them on the bed at the time of surgery, cover them in chucks, and the patients go home with them on.
Wow.
Isn't that awesome?
Yes.
Thank you to the hospitals. Thank you to
Yeah.
Prairie. This is something that is so nice to give our patients because, we worry. We want you to be successful. We don't want you to have problems. We don't want seromas or bleeding or complications. We want everything to go as perfect as we can. So any tool that helps us to do that, we are all about. And this product helps us to do that. I really am happy to be able to give it to our patients.
And I think what I'm hearing from this and what's important for me, for everyone to hear, is find a compression bra or a coverage that gives you safety and security. It doesn't have to be a hugger, but know what to look for. So seamless knit where there's not seams. Something that you can clasp in the front. There's a lot of things I hear often. It's, well, get a good sports bra after you feel a little bit better. Well, that sports bra is so compressive. It's got a very compressive band. If you have larger breasts, the band is digging into your shoulder. You get a red mark under your breast where the band is. It's not good. So I think just learning, whether it's a hugger or something else, there are better things out there. So feel empowered. It's similar to asking the questions, ask for a better bra because there is one out there, a hugger or something else, but
For sure.
seamless knit, front closure, those are all so important. And Toni's being a little bit modest as you always are, but she was one who really pushed through using it directly in the OR so that a patient from the time they have their surgery to when they wake up in the recovery bed, they have their compression on and they get to go home with that. And then the hugger, other bras do this too, but is made to wear for that 6 to 8 days. You don't have to take it off,
Right. That's
So,
amazing.
Oh, and
That
it's
really is.
antibiotic impermeated too, which I think is important. Not that that's perfect, not that you can't have an infection, but that is part of what allows it to be worn during that time. And again, it's kind of like maximizing everything we can. Like I am a big fan of putting my patients on probiotics and vitamin C preoperatively, and I'm a big believer in what we call ERAS, which means enhanced recovery after surgery. And this is because, Natasha, you know how you're talking about learning and asking as well? We learn so much from you guys. This garment, this hugger, is really something that has been developed based on patients teaching us in combination with what we as providers are worried about and kind of marrying it. And I love that. Again, it's like what I feel like the relationship should be between a patient and their provider. We are a team. We are a team. And the patient is in the center of that. And I feel like the hugger helps to do that as well.
I agree. It's so comfortable. Whether it's 4 weeks post mastectomy or 4 years, honestly, it's ideal. It doesn't, like you were saying earlier, it doesn't dig into your skin. It almost feels like a second skin in many ways, from my experience.
Mhm.
And I wear them in a variety of ways. I wear them as like a crop top as well as a sports
You're so
bra under my
cute.
shirts.
Yeah.
So it works. I love it.
And I'm seeing, guys, this has gone so fast. We're already a half an hour in. These always go so fast. And I've seen lots of questions come up. Please DM us or send us an email, your support at prairieware.com. We're here for you. You can also check out, I think it's at Toni
Oh,
Storm and at Natasha After Breast Cancer.
yeah.
So we are here to answer your questions. And we probably obviously aren't going to get to them because the half an hour went so fast, you
I
guys.
just can I
It felt
It
like
say
is
one
5
thing?
amazing.
I'm reading little notes.
Yeah.
I have to say I have the best patients in the whole wide world.
He
Yes,
does.
use it after
Oh,
lumpectomies. Absolutely.
Yeah.
Because your surgery should be done with oncoplastic techniques because you deserve to be beautiful.
Mhm.
yeah.
Yeah. And that whatever bra you choose is really made to be part of your recovery and beyond and into activity and everyday life. So there are some really great choices out there, and I'm so glad you guys are here to hear about some of them today. Is there anything you guys want to leave with our people today? That went so fast.
Um, hmm. I, I think that I would love to leave everyone with, I guess, just to kind of reiterate what Dr. Storm, what you said earlier, which I think is so important. Um, it is our individual responsibility, right, to figure out how to find joy in the now. So I'll put it that
Mm,
way. And I really love the fact that you repeatedly have said it is by far, it is not easy, because there's duality in it, right? You can love something that's also very difficult. You can love life, but be angry at it at the very same time. But with intention, if you try to find the things that do make you happy, it makes it just a tad bit better, even if it's temporarily, because most things in life are temporary anyway. So, just know that it's your individual responsibility. It's difficult, accept support, and try. It's hard, but try.
Brilliant.
thank you.
You're right. I do love her. She's great. The other
I
thing
know
I
you do.
say to my patients a lot and is take care of yourselves because again, sometimes we don't. We put ourselves on the back burner and we're worried about everybody else. But there is a very important reason that if a plane's going down, they tell you to put your oxygen mask on
Mhm.
first on yourself because you cannot help anybody else if you pass out. You cannot recover more quickly or help your family or get back to work. All those things that we worry so much about if you don't take care of yourself so that you heal as quickly as you can and are able to come back as strong as you can. So
Mhm.
please remember to take care of yourselves.
I love that. And I also love with that, one of the things that Natasha said is accept support. And so
Yes.
give yourself support, accept support, and that's a really big gift that we can give ourselves and those around us. So thank you guys. Thank you for supporting me today and being here with our Prairie
Absolutely.
Circle and sharing your stories. And Natasha, seriously, I love your feed. She's the best dresser, everybody.
Oh,
I'm just like right on point all the time. I love it.
you're so sweet.
So
Thank
can
you.
check it out. Yeah. All right, guys. Thank you so much for joining us today. We really appreciate it. You guys are welcome anytime, every time. And if there's questions, please send us a DM or send us an email. Thank you so much for joining us today, you guys.
Thank you. Good
Thank
Thank
night,
you.
you.
everyone.
Bye.
Bye.